Approximately 5 million people per year seek medical attention for urinary tract infections, or UTIs. A urinary tract infection is an inflammation of the urinary tract, most commonly caused by Escherichia coli bacteria, commonly called E. coli. Normally, the bladder has several protective mechanisms that keep the environment sterile despite contamination. Loss of resistance to invading organisms and incomplete emptying of the bladder compromise these protective mechanisms. E. coli gain access to the bladder most often by ascending from the urethra. The organism then attaches itself to the inner lining of the bladder and colonization begins. For the most part, factors predisposing clients to UTI result in contamination of the tract, obstruction of the tract, or inefficiency in the function or structure of the tract. There are several risk factors that increase urinary tract exposure to contaminants and cause urinary stasis, thus providing greater opportunities for the organism growth and survival. Factors that can lead to contamination of the urinary tract include a relatively short urethra in females, insertion of indwelling catheters, straight catheterization, cystoscopy, ureteral dilation, sexual intercourse, and menopause-related changes. Factors that can lead to obstruction of the urinary tract include renal calculi, commonly called kidney stones, ureteral calculi, and congenital abnormalities. Factors that can lead to inefficiency of urinary tract function and structure include benign prostatic hypertrophy, neurogenic bladder, and anticholinergic medication. Other contributing factors that were once believed to cause UTI, such as tampon use, wet swimming suits, pantyhose, and tight clothing, are no longer considered significant in the development of UTI. The reason that so many people seek medical attention for UTI is directly related to the signs and symptoms that develop in response to the infection. Only about 10% of clients with UTI are asymptomatic. Most clients are very symptomatic and report frequency, urgency, voiding in small amounts, inability to void, inability to empty the bladder, painful urination called dysuria, cloudy urine, foul-smelling urine, hematuria, lower abdominal discomfort, lower back pain, fever, chills, malaise, nausea, vomiting, and a change in mental status in elderly clients. A urinalysis can be used as a screening mechanism for clients who have the characteristic symptoms. Typically, the presence of nitrates and WBCs indicate that bacteria are present in the specimen. A urine culture is necessary to confirm the diagnosis of UTI. Colony counts of 100,000 per milliliter have been used in the past to confirm UTI, but active infection can exist with much lower colony counts. Once the diagnosis has been confirmed, antibiotic therapy can be initiated. However, the healthcare team should investigate the underlying cause of the infection. The presence of symptoms will determine whether or not antibiotics should be prescribed. Symptomatic clients will take antibiotics from 3 to 7 days, depending on their age, whether or not they are pregnant, and their frequency of infection. Trimethoprim sulfamethoxazole, trade name Bactrim, and nitrofurantoin, trade name Macrodantin, are common first-line choices for treating UTI. Cephalosporins can be used if urine cultures indicate that they are appropriate, and fluoroquinolones, Cipro for example, may be necessary if the infecting organism is resistant to conventional therapy. Advise clients to increase their fluid intake to 3 to 4 liters per day, unless the fluid increase might worsen a coexisting disorder, such as congestive heart failure. Increasing fluid intake will dilute the urine, relieve bladder irritation, and prevent or reduce urinary stasis. Very simple changes in hydration, elimination, and hygiene can make a huge difference in the client's rate of reinfection. So, in addition to increasing fluid intake, teach clients to urinate frequently and wash the genital area daily, wash before and after sexual relations, and practice safer sex. And for women, avoid deodorant feminine hygiene products and wipe the perineum from front to back.